Probably the most useful contribution one can make is to forget oneself and care for others.
My mum first became involved with the Royal Children's Hospital when she was about 15 or 16. She was at boarding school and she knitted the most woolly garments of anyone in the school, and the prize was a visit to the Royal Children's Hospital. And from that moment on, she became very keen to get involved. She was a young mother, and Lady Latham could see that maybe Elisabeth would have something to contribute, and she invited her to join the board of the hospital when she was only 24.
I think Granny's experience of visiting the hospital and visiting the sick children, I think anyone who goes into the hospital and sees sick children, she would have come away saying, what can we do?
I was so horrified with some of the tragic cases of conditions due to birth defects, genetics, that I felt something ought to be done to try and find out the cause of these awful things. And that's what David Danks was committed to.
My mother and Professor David Danks, they worked really well in partnership. She and David together put up a proposal to Rupert and Helen and Anne and myself to help fund the establishment of the Institute. Jean Miller of the Miller Foundation and the Brockhoff Foundation all agreed, and that's what helped establish the Institute.
I first got involved with Dame Elisabeth when we had a child in the hospital here in 1985, and you would see Dame Elisabeth trotting along the corridor, tap, tap, tap.
I hear you've been a very good, brave girl.
Yeah. She was the most enthusiastic, driven sort of a lady, and she was just determined to see a change. As was David Danks, and he saw the possibility of making real changes. Genetics was a fairly new field, and David was one of the pioneers of genetics.
My initial work with David was focusing in clinical genetics, so in the practice of evaluating, diagnosing, and then managing children with genetic disorders. As a researcher, I can tell you that philanthropy has been incredibly important in allowing me to do the kind of research I wanted to do. Often, the funds that have been provided to us through philanthropy that have allowed us to generate that pilot data that then put us in the best possible position to get more sustained funding to be able to progress the research activities.
There are many donors that have become really passionate about the research that's done here at the Murdoch, and it's almost become a family.
I had dinner with Dame Elisabeth, Janet Calvert-Jones, and they raised the prospect of me joining the board of the Murdoch. I could see that they were really doing important work, something that impacts on every family. You know, I'm a grandparent now, I was a parent then, and I could see how important it was when, especially young children, had some sort of ailment.
What amazes me is that we're doing research that's immediately translating into clinical practice. We're making a difference right here, right now. When Dame Elisabeth and David Danks were working together to establish the Murdoch Children's Research Institute, they could not have foreseen what was going to be happening 20 years, 30 years, 40 years down the line. It's phenomenal. Genomics and genetics is now underpinning so much of medicine. MCRI has now established an amazing reputation. And because of that, we can attract the most brilliant minds. They are our greatest asset, this amazing group of scientists, researchers, clinicians working together to solve the big problems in child health. Our vision for the future is that less children will need to come into hospital. And if they have to come into hospital, they'll stay a much shorter time because they get the right treatment first time.
I just think it's really exciting that we have an institute that's doing this world-leading research into children's health. I think Granny would think it's amazing how far MCRI has come today and what an amazing impact it's having in Australia and overseas. And I think due to her vision and commitment all those years ago, we are seeing those benefits now. And it's really quite an incredible story.
If you've got money, it's perfectly easy to give it away and nothing to be particularly proud of. But it's being involved and knowing what you're helping and you know, really being committed. But it's very rewarding when you feel that you are making a difference to the lives of other people.
Thank you.
Thank you